Matariki is the Māori name for the star cluster Pleiades, also known as the Seven Sisters. Matariki is also the name for an international network of 7 universities that are distinguished by their historic traditions and unique approach to facing contemporary challenges. The Matariki Lecture Series offers a short program of lectures addressing current research themes or areas of common interest.
This time, the lecture series is on race, racism, and decolonisation, with a specific focus on decolonisation.
Okay, so can you see my first slide? All good? Okay, great. Thank you. So really a pleasure to be here with all of you. I want to welcome all my Matariki friends and colleagues and say good evening, good morning, good day to all of you. And I'm here to talk about decolonizing global health through building equitable partnerships. Let's see if I can advance. Okay, so first of all, we know that global partnerships are quite common across all university academic settings and certainly across the Matariki network. I just grabbed a few examples from the internet here. So all of our institutions have several global partnerships. And if we think about global health collaborations, many of us may be saying, well, this is really a lot of what I do. This is my sort of bread and butter of my work. So why do we need to talk about them now, and how do they relate to decolonizing global health? And what I'm here to do really is to challenge the way that we have been conducting our global health work. If we look closely and honestly at our global health partnerships, we may see that they're not necessarily balanced or equitable, or not as balanced as equitable as we might hope or like. And equity is particularly important when partnerships are forged across a great resource divide, when institutions in high-income countries, like all of our institutions, partner with those in low-income countries. If those of us from the high-income countries, the well-funded or institutions, choose to ignore or pretend that this resource divide doesn't matter or exist or affect how we are perceived or received, we risk unknowingly replicating the very inequities that we seek to mitigate. And I would venture to state that the stakes are higher than we might think. Getting these partnerships wrong can have grave consequences. Many of us have heard of partnerships that have ended poorly or were put in jeopardy by bad behavior, or perhaps more commonly, many of us can recount failed efforts in which an assessment was made about what a high-income partner identified to be a critical gap, and with some perhaps tacit agreement or polite acceptance, maybe from the incorrect set of stakeholders, that high-income country partner plowed ahead, as our type A personalities tend to do, with a solution to a problem that was not really a problem or a priority for the populations they were working with. And that was met with a big fat failure. And I say these failures come at a cost. Costs in the form of eroded trust, of squandered resources, and continued disempowerment. And frankly, it's time that we stop learning these lessons on the backs of these communities. So if awareness of these complex issues is the first step, how do we avoid replicating the very damaging patterns of inequities that we're striving to eliminate? And to do so, I'm going to put forth that we need to have a paradigm shift in global health. Global health, how we conduct ourselves in our global health partnerships. And I'm going to offer 4 major paradigm shifts to get us started. So the first paradigm shift is we really need to move from thinking about global health in the realm of charity or good deeds, really more into the realm of global citizenship, of global security, of human rights and the social justice framework, and partnership with interdisciplinary collaborations. And I would venture to say that the pandemic that we're all still living through really has taught us how we are more connected than ever before, and how these concepts of global citizenship and global security are really so essential to how we conduct ourselves, and certainly in this work. The other piece too that I will say is I think we need to recognize global health as a rigorous academic discipline unto itself. I often said we wouldn't want sort of internist, internal medicine doctor who dabbles in surgery to take out your appendix. Well, I don't think we want to encourage people who sort of dabble in global health work. I want us to recognize that this is a well-founded, now well-established and rigorous academic discipline. And so we're really talking about getting out of bringing it into sort of a feel-good moment for our students who go on these many of these short-term experiential learning opportunities, to think about the good, the bad, and perhaps the ugly from volunteering and voluntourism. And again, to ground ourselves and link ourselves with true academic partners who recognize the rigor that we need to bring to doing global health work. So, a second paradigm shift. I think we need to remove that artificial distinction of global versus local. As a very astute colleague of mine once said, our global, whoever we are, our global is always someone else's local. So I think we need to think about that, why global settings might be more appealing to our students, so that if I ask a student, would you like to go work in this setting, with this family in some unidentified Southeast Asian country to do a global health project, they tend to get very excited, say yes. And why do you want to do that work? Well, I think I can make a difference. I think there's needs here that I can help serve. I think I can have some impact. And then if I show them sort of a more local setting, similar family, and say, would you want to go do some work with this family where there might be substance use disorder issues and what have you, and you know, this family living in rural poverty, which is something that we don't always really acknowledge in the United States. And they say, well, I don't know. I don't think I could have an impact there. I think the problems are too deeply entrenched. And what I think we need to recognize is that what's the difference between these two settings? It's not that there aren't deeply entrenched settings and deeply entrenched issues in both of these settings, but it's that we have a difference in our understanding of the context. And until we sort of dive really deeply and strive to understand context, historical legacies of the places where we work, we can't think about what our impact could or should or might be. And I think we have to think about the historical legacies and context where we work, whether that's across an ocean or across town. Paradigm shift number 3 is about saying it's not about pins on a map, that this is about bringing, certainly in the global health education sphere, our learners to the world and the world to our learners. And for that, I think it's really critical to practice reciprocity, to sort of equalize the benefits across the partnership. And so therefore, if we send a Dartmouth medical student like Nareth Carlisle to work in Tanzania, we have to be willing to accept and support students, Goodluck and Jacob, to come to Dartmouth Hitchcock Medical Center for their clinical training as well. And when you do that, I find it very revealing, because our clinical faculty said things like, gosh, Lisa, this is really hard. I have to orient them to, you know, our healthcare system, to our medical record, to how we get things done, to our medical culture. And I had to say, but don't you think our colleagues in Tanzania have to do that when we send our medical students there? And yet we would never hesitate to send our students abroad, thinking that they're doing something noble, they're doing something good, they're going to contribute and make a difference. And so I tell you that reciprocity piece is very eye-opening and a great education for some of our faculty as well. And then paradigm shift number 4 is just a reminder that this should not be about us, that this is about placing the partnership at the center of the work that we do. It's about focusing on process, not just outcomes. So it's not just what we achieve, but how we achieve it and how we achieve that together. Following our partners' lead, making sure that their priorities drive the agenda for the work that we do. And all of these paradigm shifts together, I think, will help us come to what I call the resultant paradigm shift in decolonizing our partnerships and thereby decolonizing our global health work. So I think we need to constantly be asking who's driving the activities that we're engaged in. And this concept of first, do no good is a reminder that we give to our students. You've all heard of first, do no harm, perhaps. But the first do no good is a reminder to our students who are really rewarded through their academic careers many times for being, assertive and outspoken and kind of making sure that their opinions are known and speaking up and really trying to be sometimes not even assertive, but almost even aggressive in making their thoughts and opinions known, and being very confident in what they say. And I tell them to undo all of that learning, sit back, step into listener mode. And if we say to them, your goal is not to accomplish anything, is to first do no good, that allows them to do that more easily, to say, okay, don't need to go there and kind of elbow my way forward to try to accomplish things and have my own agenda to accomplish. And so that's a sort of regrounding. It's a little bit provocative, but a way that a colleague of mine has helped our students rethink their roles in our global health partnerships. We have to be thinking about, how do we co-design? How do we co-problem solve? What does that really look like when we're doing it across borders, across cultures, across history, across power and financial dynamics? So I think that's a question we need to constantly be asking ourselves in these partnerships. We need to be careful and watch our language, our behaviors. Maybe we say and do things without being aware of the impact that it may have. So we have to be really attentive to that. And I think we have to do more listening than talking. And again, I think we constantly need to be striving to understand the context and legacies of the places where we work. So I'll end here with this otherwise unattributed African proverb that guides our work. If you want to go fast, you go alone, but if you want to go far, you go together. And I always say we're in this for the long haul, to go the distance. Thank you.